Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight on my Facebook Live. So today we're going to talk about some of the myths about colon cancer and some of the things you may have heard about. I want to see if I can dispel some of those myths that may be out there. This is in celebration of Colon Cancer Awareness Month. We're trying to bring more awareness to colon cancer. This is the second leading cause of cancer death in the United States, but it probably is the most preventable cancer that's out there. And I'm going to try and do the best that I can, see if I can answer some of those myths to hopefully get them out of the way so you don't have to worry about them and you can know what the true things you have to worry about when it comes to colon cancer and colonoscopy. So, like I mentioned before, colon cancer is the second leading cause of cancer death in the United States, but that rates have been decreasing, especially in older individuals. And the reason we know this is because we have more and more data showing that colonoscopy actually saves lives. The risk for colon cancer has gone down tremendously since the advent of colonoscopy in the early 2000s, and we're preventing more and more polyps from developing and removing those polyps before they become a cancer. And for somebody without a family history, the screening interval starts at the age of 50 years old. So the first myth I want to talk to you about, number one, if I don't feel bad, I do not need to get screened. You don't know how many times I hear this from people who come to see my office not willingly or wondering why they're having to get a colonoscopy if they don't feel bad. The screening option that we have for colon cancer is to find precancerous polyps before they actually become cancer. So the whole point is that we're doing the procedure because you feel well, because you don't already have symptoms that develop from having colon cancer. And so we want to find those lesions that can become cancer before they actually become symptomatic, because usually by the time you have symptoms such as pain, bleeding, weight loss, it already is too late. The boat has already left the water and you're already having the complications that can occur from colon cancer. And so the reason we screen for colon cancer is because we want to find these precancerous lesions before you actually have symptoms. The vast majority of people who have precancerous polyps do not have any symptoms from that. They could be growing this cancer or this precancer inside their colon without even knowing it. This is why we recommend getting a colonoscopy done even if you don't feel any symptoms whatsoever. So myth number two, the colonoscopy will be painful and embarrassing. I have a lot of people who are worried about the pain from the colonoscopy or the embarrassment from that. I will tell you that the colonoscopy is a painless procedure. You are asleep the whole time. You will not wake up. We give you good medication to put you to sleep quickly, and you wake up very quickly as well. You will not know that anything is going on. In fact, the most common thing that we hear from our patients is that this is the best nap they've ever had. And so whenever they wake up from their colonoscopy, they feel great. They're wondering if the procedure has even started. And I'm happy to tell them that we are done with everything. And so the colonoscopy part is a very simple process. It takes about 20-30 minutes. You're asleep the whole time. And you wake up feeling refreshed, and you will not wake up during the procedure. So myth number three, one colonoscopy is all I ever need. And this is a very important myth to dispel because that's not the case. Just because you've had one colonoscopy, it does not mean that you're one and done. You have to have a colonoscopy at least once every 10 years. And if you have a family history of colon cancer or colon polyps, you actually may need to have it get it done even sooner than that. Or if you have a history yourself of colon polyps, you need to get it done even sooner than once every 10 years as well. But I will tell you the good thing about the colonoscopy is that typically you do not need it once every year. In fact, if you've had one colonoscopy done and you don't find any precancerous polyps, and there's no family history of any colon cancer or colon polyps in your family, you're done for at least 10 years. And so keep that in mind. Even though the colonoscopy is not done very frequently, make sure you don't forget about it. It's not one and then you're done. It's one at least every 10 years. So myth number four, I am too young to have colon cancer, so I don't have anything to worry about. And this is a very common question that I get from a lot of my patients is that, I'm young, I'm healthy, I have kind of minimal symptoms, not a big deal. And I will tell you that we do know for a fact that colon cancer is rising in younger individuals. If you go back to my other videos, I talk about this. The most common symptom from people who have colon cancer less than 50 years old is bleeding. And so my recommendation to you is don't ignore your symptoms. If you have bleeding, weight loss, unusual amount of diarrhea, getting up in the middle of the night to have a bowel movement, make sure you speak to your healthcare provider about whether something else could be going on there. You don't want to miss something we can find very quickly and easily for you so that we can hopefully address those issues that are occurring. Myth number 5, I hear the prep is the worst part. Well, unfortunately, this is actually not really a myth. It is actually kind of true. I will tell you the prep is the worst part about the colonoscopy. I cannot say that it's not. It's not the most pleasant thing. It's just not fun. But I will tell you a couple things. Number 1 is that the preps have changed. We do have better tasting preps and less amount that you have to take. And so the volume of that big gallon of prep you have to take before may not be the type of prep you have to take now. We do have different preps that are out there that taste better and are less volume and don't dehydrate you as much. And like I tell all of my patients, if you're worried about the prep, it's better to take the prep, have the colonoscopy, than take the chemotherapy when you have colon cancer. And so when you choose the lesser of the two evils, by far, taking the prep is the lesser of the two evils. So in summary, these are the 5 most common myths I hear about colon cancer. Number 1, if I don't feel bad, I don't need to be screened. This is why we do the colonoscopy whenever you feel good, so you don't have any issues whenever symptoms do occur, because usually by the time you have symptoms, it's already too late. Number 2, the colonoscopy is painful and embarrassing. This is not the case. It's a very simple, easy procedure. You're asleep the whole time. Number 3, 1 colonoscopy is all I ever need. This is not the case. It's not as often as once a year in most cases, but at least once every 10 years is all you need for a colonoscopy. Number 4, I am too young to have a colon cancer, so I don't need to worry about anything. If you have symptoms that are concerning, such as bleeding, weight loss, significant abdominal pain, make sure you speak to your healthcare provider about what else could be going on or whether you need to get further evaluation to see if you have colon cancer. And number 5, I heard that the prep is the worst part. Unfortunately, that is true, but I will tell you the preps have made tremendous strides in terms of making it less volume and better tasting.